industry. And Reach Live is a partner to us here at Ipsos. And it's an absolute privilege and honor to have Jacques with us today, Dr. Kpodonu, who has done some, today's talk is just going to be a thrilling ride because there's so much to talk about. He's a very hard man to pin down. So I'm very happy to have these 30 minutes with him today. Jacques, I welcome you to Reach Live, and I welcome you to first open with an introduction to you and your role before we get kick-started.
Good morning from Boston, and Reena, thanks very much for the kind introduction. I would like to also offer a thank you to Rich, the leadership of Rich, for inviting me to talk a little bit about what I do on a day-to-day basis. So in terms of introduction, I'm a cardiac surgeon. I work at Beth Israel Deaconess Medical Center in Boston, and I am also a faculty at the Harvard Medical School. I also have a dual role as an adjunct professor at the University of Ghana. And most of my work is focused on leveraging, addressing health disparities through technology in the field of cardiology.
Thank you. Thank you so much. So today the topic is artificial intelligence in cardiovascular care, a topic that you're very passionate about. I've seen you do many different talks about it. Let's open with it. For those that may or may not be familiar with the therapy area, but also just what role artificial intelligence could play, tell us a little bit about what you see as the vision. Why are you interested in artificial intelligence within cardiovascular care?
Well, thanks, Reena. Artificial intelligence is one of these enabling technologies that everyone talks about. We think artificial intelligence could augment what we do as clinicians, not necessarily replace us, but augment some of the processes, especially in terms of the workflow, in terms of improving access to care, in terms of improving outcomes. And so over the last 5 years, I've really developed an interest in leveraging mostly digital health technologies and applying artificial intelligence, especially in improving diagnostics for emerging countries. So a good example of where we can leverage artificial intelligence is in EKG, for example, being able to diagnose arrhythmias or irregular heart rates. So I will demonstrate to you some of the technologies that I'm using. So this is a nice wearable piece of, it's basically a 3-lead EKG. It's a wearable, so you could attach it to your chest and walk, shower, run, do anything you want to do. And then it collects data over 3 days, and then you can remove the chip, connect it to your computer, and download that whole data set. So this, for example, transforms how we've traditionally done Holter monitoring, right, for patients. Another technology that I'm leveraging is this credit card device, which is also a pocket-sized wearable, which can also capture 1-lead EKG, as well as a pulse oximetry through those 2 leads here. And this data will then be transferred to your phone through Bluetooth, through your app. And with that app, you have all your data downloaded. Now, if you think of how we can leverage artificial intelligence on the back end, then you end up having predictive tools being built that are personalized to you, the individual. And that can also be translated to the population as a whole. So these are some of the technologies that I'm actually currently leveraging. Most of this is being done in Africa and Ghana. And I do think that we are getting to that point where most of these technologies are going to become commonplace in everyday care.
Thank you, Jacques. I love it. I love seeing practically When we talk about technology, sometimes people are like, well, what does it mean? We talk about artificial intelligence today. But you're showing, really practical devices that can be attached to the body, which is obviously wearable form. But then it's the data that's streaming behind it and what it's going to collect and how you leverage AI to do something with that data. So let's talk about there's so much to say around outcomes. So we get it. There's technology. There's a lot of technology. We could use it in practical senses. And as a clinician, you can see the benefit and the ease of giving that to someone and using it in their home. But the number one thing I hear often when doing research with doctors is excess of data. How do I deal with all this data coming through? How do I make it legible for me? How do I use it to really be pointed and diagnostic? Talk to me a little bit about your experience with that.
Yeah, so I think this is one of the important questions about data and how we are going to leverage all this data. Obviously, we can't do it all on our own, right? So we also depend on our partners from industry, that are building some of these, data platforms. And so we love to collaborate with some of our industry partners in some of this kind of research. So again, I'll give you a good example of what we're doing right now. So here I can show you, you could see this. This is a point of care ultrasound device, which has a USB port and will attach to a Samsung tablet, for example, right? So you could take your tablet with this probe and do a cardiac echocardiogram, and then leverage AI to actually calculate the ejection fraction. And so this is kind of the work we are doing right now, where we are putting this into the hands of non-specialists, non-trained cardiologists, to be able to actually leverage AI to do those echocardiograms, quantify the ejection fraction, have that data sent to a cloud platform. And then on the back end, I can be sitting here in Boston and actually review images that are done out in Ghana. So again, you can see how technology, leveraging AI to develop new ways to increase access, and then again leveraging cloud infrastructure technology to make that data available to whoever needs to see that data. So I believe that the future is going to be about what I call distributive research, where many folks can have access to, can share their data, and that data can be used on the back end for research. So this is where I see research, heading, where we blend traditional methods with technology. And again, as I mentioned, it has to be a partnership between clinicians and industry to improve the way we've done research across all, but not just in cardiology.
Thank you. There are many people that are invested in technology, and you talked today about a study, and the study that you're running. What advice would you give when it comes to designing studies of this nature, and how do you go about, structuring something to prove outcomes? Because that can be quite a barrier for a number of developers and people that are interested.
So that's a great question, and I think I would like to spend a little bit of time to really dive into this question that you've asked, because many a times we come across great technology that has been developed by great engineers, and basically you're looking for a solution for that technology to be applied in clinical medicine. And I always say that that's the wrong way to look at things. You need to co-design technology with clinicians, meaning what's the question that we need to answer? What is the problem that we are trying to address? And then once we define what that problem is, or the scientific question or the research question, then we can leverage technology around that question to build a designed study that then takes the technology with the clinical problem to solve that problem. So I'll give you two good examples of research that I'm actually undertaking. And those are all NIH-based research. So the first one is on hypertension. We know hypertension affects probably 30 to 40% of populations globally. So what we're doing is that we're taking a digital health platform. We're leveraging that with digital blood pressure cuffs, any diagnostic cuff. It doesn't have to be, proprietary devices. And we are customizing those platforms to the local population in Ghana. And we are saying, 2 or 3 times a day, take your blood pressure, input the data either through Bluetooth or manually into the platform. And then we will see what happens over the next couple of weeks. We get all those data sets. We then on the back end are able to look at those data sets and apply artificial intelligence to figure out exactly if there's a predictive model, which is personalized to individuals, right? So that's one way we can leverage artificial intelligence. The second study, which is actually a more interesting study, is we know sickle cell disease affects a lot of folks in Africa and also in African-American populations here in the US. And in Africa or in Ghana, for example, there are less than 25 cardiologists for the whole country of a population of 30 million. So how are 25 cardiologists going to be able to do cardiac ultrasound on these patients? So again, this is where we have designed a study around this device with AI, where we are now going to train non-physicians to actually do the echoes using artificial intelligence. So we spent 6 weeks, we train them, we teach them how to do the echoes. We then, the AI then computates the ejection fractions. We then have those data sets sent to us here in Boston. We then classify those data sets and we send them for machine learning. So we're hoping to do this with 2,000 patients, 2,000 cardiac echocardiograms, and build the largest cardiac echo data sets in sickle cell in the world. So I'm really passionate about this study because this is the first time we're going to probably have data sets, probably the largest in the world, coming out of Africa. And so I know we've talked a lot about AI and health disparities. I think this is one of the reasons why that work is very passionate. And I'm sure we'll discuss a lot about that in our future conversations.
Absolutely. No, absolutely. You talked about 2 large studies there that both have such clear, problems to be solved. And what I love as well is the thinking ahead about scalability. So your train the trainer aspect of your design is what's going to help, because we don't have enough clinicians to handle the bandwidth, right? And then also interpretation of that data requires a certain skill set, and you're learning constantly. The predictive models you spoke of are work in progress. They're living organism, really, aren't they? Because you're constantly adding to the data set and learning.
That's right.
For you, in terms of the scalability, you've talked about some really nice things there, and you're upfront in your design that you're kind of thinking through. What else is important to really move the needle for this not to remain a clinical paper journal that we all say, oh, great that we did that, but actually, no, let's make this happen. What's your thoughts there? What's needed?
So that's a great question. And in fact, that's one of the most important questions, because technology comes and goes, and there's always going to be the next great technology down the road. But how do you, again, design technology, co-design technology that solves a particular problem, and how do you scale? So again, I'll give you a blueprint of how we are approaching this. Part of this research project on sickle cell, we've engaged some of the stakeholders. One of the stakeholders is the Ghana Health Service, right? Ghana Health Service it's the largest provider of healthcare in Ghana. So it will be the same thing where you will go to one of the large healthcare systems here, approach them and say, hey, we are designing a study. This is what we want to do. It's going to start as a pilot, but we obviously want to take the learnings from that pilot and be able to scale it across the healthcare system. So we've done that with the Ghana Health Service. The next thing you need to do is you need to partner with your industry partners. So again, we talked about data, right? Data is going to be transferred and data needs to be stored. So what we've done is we've partnered with some of well-known names like Google. Google Health is one of our partners on the sickle cell study. And what we intend to do with them is to leverage some of their wearables and also leverage some of their data infrastructure and then build AI on the back end. And again, this is going to have to be a co-development series because one, I'm not a data scientist. I understand the principles, but I'm not going to be coding. So I need, I need coders, I need machine learning experts, and I need industry to help in terms of how we're going to scale. So we've done a few of these partnerships with the Ghana Health Service, Google for the data. We've partnered with Novartis for sickle cell because they're developing new therapies for sickle cell. And they are interested in the data that we're collecting from the sickle cell patients, especially around cardiac, the cardiac manifestation. And so once we have that data, Novartis can then go back to the drawing board and design a novel therapy using AI discovery platforms. So again, it's a matter of bringing the right stakeholders around your research problem and engaging everyone to the table. So I believe this is how we're going to have to, co-design research that can scale, not for pilots only and stop there, but research that can scale and have, a great application within a healthcare infrastructure. And ultimately, we want it to be globally. And as you know, the pandemic has taught us a lot that, it's not just in one country, you have to address it globally, right? So that's kind of how I believe we can design research-focused, problems and leverage technology and leverage all the stakeholders to be able to scale.
Thank you so much. I mean, this is why I personally find you so impressive, Jacques, because you bring the components together. We know that clinical understanding, passion for tech, going after a real problem to solve, but also managing stakeholders. And that's the pillar that sometimes gets lost by fantastic clinicians who are passionate about this space. And I think it's a wonderful, for those that are interested in developing tech, it's a wonderful testimony to really listen to about bringing players around the table, a diverse set around the table. Now, we would be remiss to talk about artificial intelligence and not talk about bias in data sets. And I know this is a topic you alluded to a little earlier as well. We've seen quite a number of studies come out which scrutinize the data sets that exist, but they lack in terms of diversity and inclusion. But if we talk about predictive models, well, who do they really serve is the question that has come up, because our predictive model will be as good as the data we put in. Talk a little bit more about that. How will we get to the point where we'll serve as many communities as we possibly can through AI?
Yeah, I think that's fundamentally the right question, is that you cannot build AI-based technology without diverse data sets. I mean, in fact, if you start off on the wrong foot, you're going to develop a technology that really has no real world applicability apart from where the data set was collected and where it can be applied. So that's something that I realized very early on, that we needed to figure out ways to develop research that basically includes everyone. And that, unfortunately, a lot of the research that is done in the US is really focused on large academic institutions like mine. And a lot of these institutions really are not traditionally, they don't traditionally have that kind of diverse data set that is needed. So it means you need to go outside your your environment. And so, and again, it also comes to how you design the study, right? So design of the study right from the beginning, I think you have to be very intentional in making sure that your study design is going to address the whole spectrum that you are intending to manage. And so that is why I focus on addressing global health disparities. And I'm comfortable going outside my environment to look for data sets or to do research. And again, it comes back also to my background, because I also have a diverse background. You know, my mom is French, my dad is from Ghana, and I've worked in different international backgrounds. So I do understand that should be very fundamental and key to designing a study, to make sure that the data set is applicable to all. And a good example I'll give you is that, for example, EKGs, a lot of the diagnostic that have been built around EKGs were built off, presumably white data. And when you look at the EKG of the African, for example, the repolarization waves are different. And that may be interpreted as maybe the patient having an ischemic event or having some kind of problem, whereas actually it's just a normal variant of the EKG. But we've never had those data sets to study. So this is, again, one of the reasons why going forward, if any technology or any researcher wants to design a study, I think they have to be very intentional to make sure that that study is as inclusive as possible.
It's a lovely message. Be intentional. It's the only way.
Yeah.
It's the only way. And I liked your comment earlier about open source when you spoke about kind of the design of a study and where you see the future, because we can't all achieve it with we've got finite resources, but we can be creative, and we can be creative by kind of opening up, like you were saying before. I do want to move slightly personal, if you allow me, because I feel what's come across today in a very short amount of time, and I'm sure those that are listening in are equally impressed with how much you're passionate about what you're doing and your drive to make a change. So what's motivated you? What's brought you into the digital health space and all the work that you're doing? So tell us a little bit more about how you came to be so motivated.
Well, thank you. I mean, I think it fundamentally comes down to who you are as an individual. And as I've mentioned, I've grown up in different diverse environments, from Europe to Africa to North America. And I have traveled quite a lot. My initial years, I was born in Europe, in France, but then I quickly moved to Ghana. And that's where my initial years of training to be a doctor where there were hardly any resources. And so, you grow up in such an environment, and so you understand how precious electricity, for example, is, or water is, right? Like there were days there was no electricity, there were days when there was no water. And so you then understand that, wow, you come to the US and wow, electricity is available, water is available, everything is there, right? So, but then it fundamentally comes back to, well, okay, how can I leverage, technology and reverse engineer it? How can we leverage what we are good at, but then use it to solve scalable problems around the world? And so that's how I got into digital health, because it became fundamentally the tool that could potentially change healthcare if you knew how to use it. And then it also dawned on me that Africa is actually a leader in mobile money. In fact, in Africa, they've been using mobile money for years now. What we call Apple Pay and Samsung Pay and PayPal, the folks there were using mobile money for transactions way back then. So, and they also have more cell phones than the rest of the world. So basically, you have the cell phone, you have a mobile slide, fintech application, why can't we leverage that in healthcare? Why can't we use that to improve access and delivery of healthcare through telemedicine, through technology like what I showed? And so that's how I kind of started to fit in the pieces. And then it came to, well, now what's the next step, right? We need to pilot. We need to go and actually, do some studies, see whether there is really benefit. And if there is benefit, how do we scale? So that's basically how I got around, that interest in digital health, in AI. And lately I've been focused on blockchain, leveraging blockchain technology, again, for distributive health and for clinical research. So again, it comes back to how do we increase access and delivery of healthcare globally? Healthcare is not a global health issue. It's not just an American issue or a European issue. It involves everyone. And so I think the impact for me will be more about how could I have improved or address global health disparities within a cardiovascular space more than anything.
Impactful stuff. Thank you. Thank you for sharing that. And yeah, the leapfrogging is there, right? I mean, we're spending so long going step by step by step and get ourselves twisted in silos, whilst they, it's the same. I speak from my background, which is Indian, and sometimes when I've gone to India and just see how seamlessly they're using digital payments, which, so I completely understand what you're saying and the opportunity that we have. We're coming close to the end. I do want to cover your vision for the future. And I do also want us to talk a little bit about the book that you have coming out this year. So wrap those things up for me. Talk to me a little bit about your vision for the future, and then also the book that you're releasing this year.
Well, thanks, Reena. That's very kind of you. I think I've summed it all. I do see a future where we transform the way we've done research, the way we provide care, from episodic care delivery models to distributive healthcare models, leveraging technology, leveraging AI, research that is open sourced and everyone can contribute their research data to a platform, drug discovery that is accelerated due to all these data sets that are collected. So I really have a very optimistic view for how healthcare is going to change. But fundamentally, I think there's going to have to be a change in our regulatory processes, at least in the US, where data is not going to be siloed in hospitals, but rather the patients will be the owners of the data. That is the fundamental change that needs to happen for all this to happen. So until we see that happening, at least in the US, it's going to take some time. But as you mentioned, it's going to happen elsewhere, right? It's happening in Africa. They are leapfrogging. They are moving ahead. And so I do see that future really a bright future, obviously, but it's going to have to involve all the stakeholders. Now, concerning my book, as you mentioned, I do have a passion for addressing global health disparities, especially cardiovascular. So what I have been working over the last few months and years has been to develop a kind of a playbook for building cardiac surgery in low and middle income countries. And by that, I mean not just the human capacity, but again, things like we've talked about. How do you build a digital cardiology infrastructure? What are the stakeholders that are required to make that happen? How do you develop a biomedical research infrastructure in low middle income countries? How do you develop collaboration between global north and global south? How do we leverage skill transfer between global north and global south? And then how do you leverage centers of excellence in the global south for other countries? So it's been, again, trying to put all these pieces together, but in a concise format that anyone in those low and middle income countries can look at that playbook and say, yeah, I think we can get our act together and we can do this. So it's kind of my giving back, of all the experiences and the opportunities that I've had here, and being able to share them, with our colleagues, around the world. So I'm really proud about this work, and I hope once it comes, I will be able to share it again with all of you.
Absolutely, you should be proud. It's fantastic, and the give back is fantastic as well. The more we share, the more we can expand our knowledge, and the more we can learn from one another. For those types of things, please follow Reach Live on LinkedIn and on the YouTube channel that we have. I urge you to follow Jacques. He's also on LinkedIn, and I'm sure he enjoys people following him and his content. He's always sharing interesting things. Thank you so much for your time, for spending your time with us.
Thank you, Reena, and thanks to Rich again for the opportunity. And I look forward to future conversations.
Absolutely. Look forward to hopefully seeing you soon, Jacques. That'll be great.
Yeah.
Thank you so much. Yeah. Thank you so much to everyone that attended. Have a wonderful Friday wherever you are. Thank you.
Thank you all. Bye-bye.